How are you?
Fantastic. How are you?
I'm doing very well. I was extremely interested in Neurolens and what it is.
So Neurolens is a specialized pair of glasses that we offer here, glasses lens design that we offer at Broadway Eye Clinic that has something called prism in them, or contour prism, that helps reduce symptoms of eye strain, headaches, fatigue at the end of the day, dry eye, discomfort with computer work.
Okay, and then I wanted to see the process of what Neurolens is and how a testing works here at Broadway Eye Clinic.
So we can have one of our technicians run you through all the testing. What you do is the technician will put this headset on you and run the test, or it will take a brief look at your eye alignment, and then it helps me as the doctor determine if you're a good candidate to wear the lens or not. It also does a little survey of your symptoms, so it tells me how symptomatic you are and how much we can improve your life with Neurolens.
Okay, and then you mentioned eye alignment.
Yes.
What is that, and how does that affect a person's vision?
So everyone has an eye misalignment. No one's eyes are perfectly straight in their head. Most people at distance, our eyes sit straight ahead, and then up close, our eyes rest out just a little bit. So when we're sitting on computer screens, digital devices for hours on end a day, we all have to cross our eyes, and our eyes just weren't meant to cross for 12 hours a day. So with that, you can get some eye strain, eyes feeling tired, fatigued. People call it normal stuff, but we really shouldn't have any of that. And that can just make your eyes feel very bad by the end of the day.
What's like the steps that you take as a specialized doctor so that you can have these patients feel comfortable following an automated test from a computer?
So I do a little bit more of an in-depth look at the binocular vision system more than just the test. The test is a general eye misalignment test. I look at how the eyes are aligned, not in the VR headset. I look at that in free space. I check to see how much you have in your compensating system for how much your eyes sit out. I do a lot more in-depth testing with my binocular vision exams to determine what kind of lens I want you to put.
Thank you. Thank you, Dr. Stevens.
My pleasure.
Bye.
Bye.